So purpose of this class is to help MBBS first year professional examination students to write in the examination. So I'm just taking example of one topic, and that is regulation of BP. I'm just want to tell you that suppose that this topic is almost coming every year. Sometimes it is coming like a clinical question. Sometimes it is coming like a long question or short question. So depending on the question, you have to just modify the answer. But topic will remain the same. And that will be regulation of blood pressure. So first I am going to show you how a clinical question came 2 years back in MBBS first year examination. It was a Prof examination. So I will tell you how you are going to apply your knowledge in writing your paper. Sometimes I have seen that you know the topic, but in the examination, you are not able to apply that knowledge. So let me discuss one question, only one question I will discuss. I will not take much of your time because your time is very crucial now. So not more than half an hour I will take class. But you will try to understand. See, question is, Sita is 55-year-old manager at departmental store. One morning, she awakened from a deep sleep and realized that she was more than a half hour late. She panicked momentarily and then jumped out of the bed, suddenly stood up. She felt lightheadedness. The first clinical symptom is what? Lightheaded, and thought she might faint. Fainting. So you can see there can be syncope, less blood in the brain. She had the sensation that her heart was racing. Now, see, normally in medical science, we say palpitation, breathlessness, but when a patient is coming to you, they will use the basic term. For example, you will say that heart is racing, meaning she is having palpitation. As she walked towards the bathroom, she noticed that this will disappear. So after some time, this will disappear. So what is the most probable cause of her lightheadedness and fainting sensation? What is the name given to such condition? And what is the mechanism of recovery? See, normally, if you are lying in a supine position, normally when we are lying in the supine position, and suddenly when we stand up, all blood will pool in the legs, isn't it? So we can all have syncope, but why we don't have syncope? Because we have regulation of BP mechanism. So that mechanism is called as regulation of blood pressure. So this topic is same. Either they can give you the long question, or they can give you short note to write a short note on regulation of BP. But this is a clinical question. But you have to write the same thing. What is that? Regulation of BP. So in this clinical case, patient was having postural hypotension. So what is postural hypotension? So what you have to write in this question? The diagnosis is postural hypotension, also called as orthostatic hypotension. Sometimes when you stand up, suddenly there is all the pooling of blood on the legs, and we feel as if we will faint, isn't it? So this is called as postural hypertension or orthostatic hypertension. Normally, it is not there. Why? Because we have two types of mechanism to regulate your BP. One is called as immediate. Immediately, blood pressure is regulated. Second is, you can say long lasting, or you can say late. In the immediate, who is the first to respond to your hypertension? Suppose there is an accident and blood is oozing out, BP will come down. So who is the first receptor to work? And that is called as baroreceptor. What is that called as? They are called as baroreceptors. See, normally your mean arterial pressure is around, we can say around 90 to 100 mmHg. You know what is mean arterial pressure? It is diastolic plus 1/3 of, what is that? Mean arterial pressure. We know that it is diastole plus 1/3 of systole minus diastole. So normally your mean arterial pressure is around 90 to 100. But when you stand up from the supine position, all blood will pool to the legs and there will be hypotension. So who is the first to regulate that BP? In this question, what we are seeing, let me go back to the question, that she started feeling heart was racing, tachycardia, and it will disappear. So what is that condition called as? This condition is called as postural hypotension. Okay. What can be the cause? It can be neuropathy, diabetic neuropathy, hypertension neuropathy, or might be deficiency of vitamin B12, because it is the neurons which are carrying the sensation. So now I will discuss what is the exact mechanism of regulation of BP. So first is BP regulation by Baro. So when your mean arterial pressure is between 80 to 1, you can say 160 mmHg, mean arterial pressure. Normal BP is what? 90 to 100. If it become 120, 140, 160, or it come down 90, 80, who is going to regulate your BP? And that is baroreceptor, and they are of two types. So these baro are of two types. One is called as, thanks doctor, thanks. So one is called as carotid. One is called as carotid, what, sinus or body? Now you must not confuse in the examination. It is not body. B is not B. Baro are not body. It is sinus. So one mistake which we make in our professional examination. Today's my purpose is not to give you PG approach. I want to give you how to write in your MBBS and how to get good marks. Okay. So baro is not body. Carotid sinus and aortic sinus. Carotid sinus and aortic sinus, and the range in which they are working is 80 to 160 mm of Hg. It is mean arterial pressure. It is not systolic, not diastolic. So how they are working? Let me tell you. For example, the afferent which is carried from carotid is which nerve? It is glossopharyngeal nerve, ninth nerve. And the afferent from aortic sinus is vagus nerve. So these are called as buffer nerve. So in your MBBS first examination, you have to write this point. What is the buffer nerve? It is a short note also in your Prof examination. What are the buffer nerve? Buffer nerves are 9th cranial nerve and 10th cranial nerve, and purpose is to maintain your blood pressure. So now they will carry the sensation. For example, let me take one sinus. This is your carotid sinus. Okay, or you can say it is your aortic sinus. So normally when blood is going, it will cause stretch. It will cause stretch. So in this particular case, what is the case? Case is that she is 55-year-old. She might be having neuropathy. So when she stand up, all blood goes to the limb and she start feeling syncope. Okay, that is why heart is racing. So this is what? This is normally we don't have like that, because normally we have carotid sinus. So how they work? So whenever BP is less, normally जब भी BP हमारा कम होता है, suppose you are standing and BP is going to your leg, BP become less. So firing become more or less. This is again mistake which we make in the examination. Firing of the sinus will be more or less. What do you think? अगर BP कम हुआ, firing कम हो जाएगा कि बढ़ जाएगा? If BP is less, firing will also be less. The firing of the carotid sinus and aortic sinus become less, and this will supply to what? Vasomotor center and cardio-inhibitory center. Now BP is less, you want to increase the BP. BP is less, you want to increase the BP, so you will stimulate vasomotor center. Vasomotor center क्या होता है? It is sympathetic or parasympathetic? It is sympathetic. So you want to stimulate sympathetic. You are standing, all blood will go to your leg. BP become less. You want to increase the BP, so you will stimulate sympathetic VMC, and this is going to cause vasoconstriction, and this will cause increase in your blood pressure, and cardio inhibitory center, which is your vagus nerve, will be inhibited. So when vagus nerve is inhibited, what will happen? Heart rate will become more or less. Heart rate become more, because vagus nerve is parasympathetic. Okay, so heart rate become more. It causes tachycardia. Tachycardia will increase blood pressure. So by both mean we can see BP is increasing. So blood pressure is increasing by both means. So when you stand up, in the case of patient, when she was standing, she start feeling what? Dizziness. So this is the reason we are not feeling dizziness. Automatically, within seconds, tachycardia will happen and BP become more. In this patient also, she is complaining that her heart is racing. Why heart is racing? Because of baroreceptor. So baroreceptor work immediately. So please don't forget this. Number two are chemoreceptor. I will show you a video also. That video is showing animation. So chemoreceptors are two. There are two chemoreceptor. One is carotid body, other is aortic body. So please remember this point. Baro are not body, baro are sinus, chemo are body, and they are having a cell. That cell is called as glomus. Now I will show you a video from my app. This is the DocTutorial MBBS app. It is not a PG app. It is for MBBS, and you can see how beautifully it is explained.
Glomus cell. They will ask you, who is the chemoreceptor in this body?
You can see that.
The answer is glomus cell.
About the glomus.
Now they will ask you, which channel is present? Then you will say, oh doctor, I know this channel. It is oxygen sensitive potassium channel. Oxygen sensitive potassium channel. They are sensitive to oxygen. As oxygen becomes less, they become very sensitive. And they start releasing neurotransmitter.
I hope you are hearing
they start
video.
responding.
Can you hear it?
So now they will ask you, doctor, tell me, they are activated by what are the stimulus that will activate chemoreceptor? There are three stimulus, doctor. Number one is hypoxia. Number two, hypercapnia. Number three, acidosis. Now you will be confused. You are telling that blood is losing, you are decreasing the BP less than 60, and the stimulus is hypoxia. Stimulus is not blood pressure. So my dear doctor, you know already, if BP become low, there will be hypoxia. The function of BP is to transfer the oxygen. And if BP is low, how oxygen will be high? Yes. So when BP become less than 60, we are going to have hypoxia. Increase carbon dioxide. It will cause acidosis. So these are the stimulus to the glomus cells, and these will be activated. When there is less oxygen, okay, this will cause what? No release of potassium outside. In the channel, potassium is always in the cell. Okay, they are open. And when oxygen become less, they are closed. Potassium increase, and potassium increase, it will open the voltage gated calcium channel, and calcium will release a neurotransmitter, and they will start functioning. And what is the function? They will increase your heart rate, your BP, your respiratory rate. How? Let me tell you. Okay, so chemoreceptors, whenever I say chemoreceptor, always imagine two things: cardiovascular, respiratory. Cardiovascular, respiratory. Baro were working only on the cardiovascular, not respiratory. But I will discuss in the respiratory chapter also. They are the same peripheral chemoreceptor which I am talking here. They are not the different. In the respiratory also, I will discuss the same chemoreceptor. So chemoreceptors have function on two. One is respiratory, other is CVS. Okay. So directly they will stimulate what? They will stimulate first of all CVS. The only difference here is that in the baroreceptor, you have noted if VMC is stimulated, CIC is inhibited. If VMC is inhibited, CIC is stimulated. Do you remember? Just 5 minutes before I discussed that. But in the chemoreceptor, when chemoreceptors are activated, both will be activated. When BP is less than 60, when there is hypoxia, when there is hypercapnia, when there is acidosis, VMC and CIC both will be stimulated. If VMC will be stimulated because of vasoconstriction, it will increase the BP, and CIC will decrease your heart rate. So BP will be more, heart rate will be less. They will ask you in the examination, doctor, tell me, if there is activation of CVS by the chemoreceptor, your heart rate is more or heart rate is less? Answer is bradycardia. Am I clear? So chemoreceptor activation on the cardiovascular system will cause bradycardia. This is the primary activation, not the respiratory. Respiratory is indirect stimulation. Secondary stimulation.
Okay, so I have just shown you a clip from my video. Now, I have discussed that we have glomus cell. So, which channel is present in the glomus cell? As I have discussed, it is, what is that channel? Please write it. It is oxygen sensitive potassium channels. I told you in the diagram in this video also. And the stimulus will be which? Number one will be hypoxia. Number two will be hypercapnia. And number three will be acidosis. So in case of baroreceptor, we were discussing about the mean arterial pressure. In case of chemoreceptor, they will work when BP is even less than 60 mmHg. Because when BP is less than 60 mmHg, automatically we start having hypoxia, isn't it? Hypercapnia and acidosis. And what will happen? It will cause increase in the respiratory rate as well as increase in the blood pressure. Because it is working on both systems, cardiovascular as well as respiratory system. Okay, so now let me play it further. It will take only 5 minutes. Okay.
Main hero will come after the interval and he will dominate the whole movie. And you know, Rajkumar, he used to come 1 hour after the beginning of the movie and he dominated the whole movie. So the dominant will be respiratory, I will tell you. Just a minute. So you will have increase in the BP because of chemoreceptor and bradycardia. Now it will stimulate respiratory center. You start having hyperventilation. Tidal volume will be more than 1 liter. Hyperventilation. And doctor, tell me, in the first chapter of CVS, I have discussed, when we inspire, vagus nerve is inhibited. There is tachycardia. Do you remember? Because stretch receptor in the lung will be activated and they will send signal to the vagus nerve to inhibit this center. And when vagus nerve is inhibited, heart rate will increase. So now, stimulation to the respiratory center will cause tachycardia because of hyperventilation. So this is the dominant effect. So now they will ask you in the examination, tell me, chemoreceptor can cause bradycardia, chemoreceptor can cause tachycardia, both, none, both. Answer is both. Now they will ask you the primary stimulation of the chemoreceptor will cause bradycardia. The dominant effect of chemoreceptor is tachycardia. So they can ask you question in the Viva, in the exam, in the MCQ in so many ways. But if your concept is clear, doctor, you can answer easily. I don't see any doubt. So chemoreceptor can cause both bradycardia and tachycardia. Mild stimulation can cause bradycardia. Moderate to severe stimulation can cause tachycardia. The dominant effect is tachycardia. And one question is very famous. Some examiner just they will come to your exam for your professional examination and you sit, doctor, tell me what is Mayer wave? They have a very favorite question. Mayer waves are found when baroreceptors are discharged or chemoreceptors are discharged. So answer is chemoreceptor. So when there is a discharge of chemoreceptor, it can cause Mayer wave. Point number 1. So when BP is even less than 60, then you can see Mayer wave. What is Mayer wave? Mayer waves are slow, regular oscillation in the arterial pulse. Slow, regular oscillation. So you know there can be bradycardia, there can be tachycardia also. Bradycardia, tachycardia. So the slow, regular oscillation in the pulse. So suppose that you are passing by and there is some patient, there is some accident is there, and as a doctor you are seeing the pulse and you are seeing the fluctuation in the pulse. And what should come in your mind? That his chemoreceptor might be acting. These are Mayer wave actually. These are Mayer wave, doctor. So if you are seeing the slow regular oscillation in the pulse, just by seeing the pulse, you can judge. You can imagine, okay, doctor are good poet. You have good imagination. You will imagine, okay, we have discussed this point that if BP is less than this, then chemo will start. Chemo will lead to Mayer wave. They are slow, regular oscillation in the arterial pulse. The first pulse will be high, then BP will lose, then they will try to compensate, then again pulse will be high, then low, then high. So this is called as Mayer wave. But just to confuse you, examiner will say, okay doctor, what are Trauby-Herring wave? Trauby-Herring wave are nothing to do with this chemo. I am just naming this to prevent your deviation from the topic. That Mayer waves are different and Trauby-Herring waves are different. Just to make this concept clear, I am using this term Trauby-Herring waves. There is a fluctuation in the BP synchronized with the respiration. So the BP keep on fluctuating by the respiration. This is called as Trauby-Herring waves. It has nothing to do with the chemoreceptor. These are Trauby-Herring waves. Am I clear? So now the poor guy, Mr. X, met with Rho.
Okay, so I have discussed about the Mayer waves because they are asked in your Viva also as well as in your examination also. So they ask you Mayer waves you will get in the Baroreceptor discharge or chemoreceptor. So answer is they will be in the discharge of chemoreceptor because your pulse is increasing and decreasing like this. So this oscillation of the pulse, increase in the heart rate or pulse and then decrease is called as Mayer waves, and they are different from Trauby-Herring wave. Okay, Trauby-Herring waves are different. I told you in the video also. So now last is the last mechanism of BP control in the immediate series is CNS ischemic reflex. So first is Baro when BP is around 80 to 160. Below 60 or 80, we can say chemo will work. And when BP becomes very less, I mean, you can say even less than 30 mmHg, your brain will not have blood. Your brain will not have blood. It is called as CNS ischemic reflex. And this is the only reflex when VMC is directly stimulated. It is the only reflex when VMC is directly stimulated. It is called as CNS ischemic reflex because after that, you cannot save the patient. That is why it is called as last ditch mechanism. Last ditch mechanism. It is the last ditch mechanism because it is the first and the last resort to save your life. And it causes severe degree of vasoconstriction. So BP keep on decreasing from 60, 50, 40, 30. When it becomes less than 30, brain will not have any blood. And your body want to save your life. So it will cause severe vasoconstriction and it can reach blood pressure even up to 200 mm of Hg. So these stages you can say are called as reversible stage of shock, compensatory stage of shock, because till now you can save the patient. After that, we are not able to save the patient. So this you have to write in this question. So what you have to write in the question? What is the most probable cause of her lightheadedness and fainting sensation? Mean that your baroreceptors are not working properly. So in this question, what you write in the first question? What is the most probable cause of lightheadedness? Normally, our baro are working. We don't feel like that. We don't feel syncope when you stand up after supine position. But this lady is feeling that because her baro are not working properly. Baro are not working properly. Number two, what is the name given to such condition? Postural hypotension. We discussed that. Postural hypotension. And the third, her lightheadedness was transient and she recovered. So what is the exact mechanism? So I've discussed exact mechanism is what? They are working like that. So when BP become less, firing become less, and they will stimulate vasomotor center and inhibit cardio inhibitory center, causing vasoconstriction, increasing your blood pressure, also causing tachycardia. That is why her heart was racing. So if you write like that conceptually, you will get full marks. So this was purpose. This was today's class. I will try to take every week a class in which we will discuss how to write in your MBBS professional examination. And also I will carry a clip, a video in which I can show how it is given in the app. It is a doctoral app. So